So for this one, the topic today is about bag valve masks. And as you know, it is a first line for rescue for any crisis situations that involves airways. So it is very important, but one thing to be mindful of is that this airway device is only as efficient as how you use it. So your technique matters a lot. It's not all about just squeezing the bag, it's also about creating a proper seal. So most failed ventilations aren't because of the bag. It's not because you're not squeezing enough, or it's not because there's a hole in it. Most of it is because the air is not going where it needs to go. So if the airway isn't open, the air goes into the stomach instead of the lungs. So what can happen with that is you can have gastric inflation, you can have regurgitation, you can even have aspirations where the secretions from your mouth actually get lodged or gets channeled into your lungs instead of your belly. Or even, the secretion should be out. So it will also, if your airway isn't open, there's reduced lung inflation. So it's inefficient bagging. So which technique is the best? One hand or two hands? So the best technique is to have two rescuers. While one maintains the airway, the other creates a mask seal. But if you're on your own, you're going to have to try to create the seal and maintain the airway. So the second rescuer will squeeze the bag. The other rescuer would maintain an open airway. So ANSCOR actually recommends two-person bag valve mask ventilation whenever possible because it provides a better seal and more effective ventilation. So the mask doesn't cover the face. The correct placement is, it shouldn't be here. The correct placement is from the bridge of the nose to the cleft of the chin. If the chin sits outside the masks, you don't have a good seal. So this is actually a little bit too big for this mannequin. So we'll swap. So bridge of the nose to the cleft of the chin. The simple sizing principle, it reduces the leak. This is also why different mask sizes exist. Bigger squeezes, does it make things better? No, not necessarily. So should we squeeze the bag as hard as possible? No, you could actually cause trauma that way. So too much volume or pressure can inflate the stomach. It can increase aspiration risks. It can reduce the venous return, and it can cause lung injury. So the goal isn't to fully squeeze the bag. The goal is to have a visible chest rise. See if we can do this. See, hold it there, lift the jaw. So the most common cause of poor ventilation is not the masks. It really is failure to maintain the head tilt and the chin lift. It's the most common cause of airway obstruction during a rescue breathing, meaning you can have a perfect masks, you can have a perfect seal, you can have it connected to the oxygen, But if you haven't got that chin lift and jaw thrusts, you still can't ventilate. Just to prove the point. Oxygen doesn't magically fix everything. Bag valve masks can actually work without oxygen. The self-inflating bag draws in room air. So if you add oxygen, the reservoir and the tubing would store some of that oxygen. Without oxygen, you will be breathing in 0.21% room air. With oxygen in the reservoir bag, you will get higher percentage of oxygen. Just for discussion, ventilation and oxygenation are not the same thing. They're two different things. Ventilation is the act of air coming in and out of your lungs. Oxygenation is delivering the oxygen into your system. The exchange of oxygen and carbon dioxide. That's oxygenation. So here's something most people don't know. Several international organizations suggested moving to a smaller adult bag valve masks or bag valves. The Australian Resuscitation Council reviewed that evidence and they did not recommend the change because current evidence was conflicting, and there's one large observational study found whose worst patient outcomes with smaller bags, these bags. Therefore, the Australian Resuscitation Council continues to recommend an adult self-inflating bag, approximately 1,500 mils or larger for adults of the usual body size. So the bag valve mask is more than a resuscitation device. Any experienced clinician can assess compliance of the lungs because they can tell with the complete seal, head tilt, chin lift, and enough supplementation of oxygen, you can have all that correct. If your lung is non-compliant, that will also show, they can feel it. So it can tell us if there's airway obstruction. It can tell us if there's a bronchospasm, if there's a leak, if there's reduced tidal volume, if there's secretions, or possible laryngospasm. The bag becomes a diagnostic tool. For most experienced clinicians, they can recognize the problems through how the bag feels before the monitors show whatever is wrong. So don't bag the patient, ventilate the lungs. So everything that you do, the positioning, the airway opening, choosing the correct mask size, the jaw thrusts, creating that seal, they all exist for one purpose, to get air into the lungs. And that's my presentation for today. How did everyone feel about that? Thank you for participating. Any questions?